Good morning, everybody. Thank you for being here. We've got a fabulous panel for you all. I'm David Leonhardt. I'm the editor of The Upshot here at the New York Times and a columnist here at the Times. Maybe more relevantly for today, I am the son of a SUNY graduate. My mom went to SUNY Purchase, and she actually worked for a number of years at SUNY Purchase after she graduated from there in the 1980s. Although she's not as young as that makes her sound. So it's wonderful to be here. It's obviously a fascinating time for higher education. On the one hand, it's quite clear that higher education is worth it. A college degree is worth it. The gap between what college graduates are making and what everyone else is making is at a record high. So don't believe all that is a college degree worth it talk. As I say, the only time people ask that question is on behalf of other people's kids. No one questions that it's worth it for their own children. It's not just money either. It's also the odds of being employed. It's health. It's happiness. It's marriage. It's all kinds of things that education appears to help. And yet, clearly, education also has a lot of challenges and even problems. The dropout rate at many colleges is extremely high, sometimes crossing 50%. There are funding challenges. There's enormous variation in quality, and there isn't always a lot of accountability. And obviously, there's a whole new world of online learning that creates both opportunities and also challenges. And what we really want to talk here today about is how does higher education take small successes and make them big? That is an enormous issue today across all kinds of fields, which is why you see such an interesting diversity of expertise here on stage, which I'll tell you about in a second. In many realms, in education, in healthcare, in technology, we see things that work small, but then when they try to go big, don't work, either because of execution or because of the population they're trying to serve. And that is one of the most important issues in so many of the realms that affect people's lives today. I would say starting above all with education, healthcare, and living standards, which is why you see the panel that you see here today. We often know how to do something right with 100 people, but that doesn't mean it'll work for 1,000 or 1,000,000. So let me introduce you to our fabulous panelists. They're going to start by talking a little bit about this question of what do we know about how to take something small and make it big, something that works small and make it big and not run into the pitfalls. And then we're going to have a free-ranging conversation. And despite the broad expertise, we really are obviously going to focus on education, on what these other areas have to say about education. So I'm going to introduce everybody first, and then they'll give you their very short opening take on my question about scale, and then we'll go from there. Sitting directly next to me is Jason Helgerson, who is the Medicaid director for New York, leads a lot of Governor Cuomo's efforts to increase quality and reduce cost growth, and before that was in Wisconsin, helping to implement Badger Care Plus, which insured 98% of the state, and in many ways is a forerunner to the Affordable Care Act. Next is Jeff Edmondson, who's the managing director of Strive Together. He's based in Cincinnati, where he had done some local work before and now does national work. It does cradle-to-career work with people, basically trying to do exactly the kind of stuff we're talking about. When you see a program that works, like a preschool or something like that, how do you make it big? And Jeff does a lot of work in Cincinnati and Northern Kentucky and really now around the whole country. He's also previously worked at Woodrow Wilson High School. I'm now based in Washington. Wilson is the largest public high school in Washington. If you're from Washington, you know it well. Next is James Quall, who's the Deputy Director of the Domestic Policy Council at the White House. He's worked on the Obama campaign. He was the Policy Director of the 2012 re-election campaign. He's been a Deputy Undersecretary at the Education Department and a Special Assistant to the President in the White House. I was actually once in a meeting with James and the President, and it was clear how much the President relied on James. There were multiple points during the meeting where when someone asked something detailed about higher education, the President's response was, James? Dot, dot, dot. Next to James is Danette Howard, who's the Vice President of Lumina. Many of you may know Lumina's goals. Danette and I were just talking about it backstage. It's to get to 60% of Americans between 25 and 64 with a 4-year, 2-year degree or a certificate by the year 2025. And we're now where? What percent?
We're at 39%.
39%, so we got a ways to go. Before being a vice president, Lumina Dennett was a secretary of higher education in Maryland. And like some of the other folks here, she's also worked directly with people in addition to having been a researcher at the University of Maryland, College Park. She worked directly with students and others at the University of Maryland, Baltimore County. Next to Dennett is Becky Margiotta, who co-founded the Billions Institute, along with Joe, who's sitting next to her, which is trying to figure out how to solve the world's biggest problems using the billions of people around the world. She's just completed the very successful 100,000 Homes campaign, which if you're a 60 Minutes fan, you may have heard about there, which is building homes for the most medically vulnerable homeless people. Becky has degrees from both West Point, correct, and the New School. And who doesn't have degrees from both West Point and the New School? Very impressive. And next to Becky is her partner in crime, Joe McCannon, also with the Billions Institute, former senior advisor at the Center for Medicare and Medicaid Services, or maybe it's Medicare and Medicaid. Also has been a vice president at the Institute for Healthcare Improvement, which has really been one of the most interesting places in the country to think about this issue of scale, trying to figure out how do we make sure that errors that are entirely preventable, that kill people in hospitals and elsewhere, can be avoided. And Joe, I learned previously, worked for both Fast Company and The Atlantic, so welcome back to the world of media. So we're going to just go down the road. Jason, let's start with you. Talk to us. How can we go from small successes to big successes without repeating the failures that so many well-intentioned places have?
Sure. First off, big system change is hard, but I believe, and my experience indicates, and as I've seen across the country, big change is in fact possible. But I think that, in my view, there's sort of 4 core elements that lead to success. I mean, first and foremost, you need a very clear vision, a clear goal in terms of what you're trying to achieve. And if you don't have that, and as our keynote speaker indicated, that can sometimes be a challenge. And if you don't set the right mission, the right goal, it can confuse your stakeholders and make it difficult, but it's really important that you achieve that. Next is you need to build and maintain momentum. And I think this is where we get to that sometimes you need to take a challenge, take an objective, and break it down into smaller component parts if you are, in fact, going to be successful. So in my case, in the case of Medicaid redesign in New York State, it's the largest government program in the state. It's a $57 billion a year enterprise with about 6 million people in the program. It's a third to almost 40% of the total state budget. So it's very, very complicated. And instead of trying to do a sort of a one-size-fits-all or a single bullet approach to trying to solve it, what we inherently did as part of Medicaid redesign was to try to break it into component parts and pursue many different individual reforms simultaneously, each implemented over its own unique period of time. And in our case, 235 different distinct initiatives implemented over, in essence, a 5-year period of time. So the goal here was to show immediate successes, build off those successes, and build a sense of momentum that the broader stakeholder community would believe in. And I'm a big believer that you have to maintain that momentum, build it, and then maintain it to be successful. Next is stakeholder engagement. And this is the big thing that we, under Governor Cuomo's leadership, have tried to do that had been different in the past. In the past, governors behind closed doors would propose changes to this giant government program, sort of come out of the box in a budget announcement, and then there'd be war. And I mean war where you had stakeholders who would engage in $30 million a year ad campaigns that would paint the governor as a horrible person who cared nothing for the people who relied on the program every day. Then there'd be back and forth in the legislature, and what turned out is most of the time the issue just got kicked down the path with very little actual progress. And so what the governor tried to do in the case of Medicaid redesign is bring those interests together and basically charge them with coming up with a plan, incorporate their ideas in meaningful ways, and try to see if you could build consensus. It's not easy, but I'm a big believer that it can be done, especially if you do the last piece of the process, which is process. And I think that's sometimes misunderstood or folks take it for granted, that you need to manage this process. You need to manage your stakeholder engagement in ways that leads to them actually seeing themselves in the final product. They need to feel like they're part of it. They're more than just, you're going to give them lip service and then move on. And that's sometimes hard because that means you need to yield power, you need to yield authority, you need to yield the center stage in terms of design and what the policies solutions are, as well as how you implement. But when you do that and you get them to buy in and have they actually see themselves in the initiative, it can be very, very powerful. In our case, Medicaid redesign, our first and foremost goal was to try to make a program that was not financially sustainable, growing at 13% a year, and try to make it sustainable. We've actually reduced per recipient spending in New York State for our Medicaid program down to 2003 levels. Which no one, I think, when we started this effort would have thought that was possible, given the track record and the path the program's on. But I'm a big believer, particularly if you break it down to those component parts and you try to engage the stakeholders and build and maintain momentum, you can be successful.
Thank you.
It's great. So I think I'm going to echo a lot of these comments, but just very quickly on Strive Together, for those of you who don't know, it was featured in that initial Collective Impact article. That made it sound like big systems change was super easy. And that's a wonderful thing, that Collective Impact seems to boil it down and make it seem like, hey, anybody could do this. Let's just wake up and hold hands and sing Kumbaya, and all of a sudden we're going to change a system. It's just not that easy. And so in Cincinnati and Northern Kentucky, which was the founding partnership, we like to say that article is a sanitized version of reality. We are working every day to change six big outcomes: kindergarten readiness, early grade reading, middle grade math, high school graduation, college entrance, and completion. We are working at that, and we have all the stakeholders brought together, and we're making progress, right? We're seeing incredible improvements in early grade reading and college going, not by starting new programs, but by actually identifying what works. But it is a struggle every single day. And I was elated to hand the work off in Cincinnati in 2011, given how much of a struggle it is, to a colleague of mine. And now we have a network of 53 communities that are trying to learn, fail forward from what we've done in Cincinnati and now what we've done in all other communities to begin to create this systems change of essentially trying to move communities from talk to action. And you can go to our website, strivetogether.org, and we have a theory of action that begins to break down this concept of collective impact into phases, where there's kind of early stage, middle stage, late stage work, where you're bringing the partners together, you're getting agreement on outcomes, and that you're beginning to really use data in new and different ways so that you're actually lifting up what works and achieving better results. But we just convened all 53 of the communities in this national network called the Strive Together Cradle to Career Network. And there were 3 clear things that these communities that have been working to drive systems change over the last 4 or 5 years, they lifted up and they said there's 3 clear things that we have got to focus on if we want to realize systems change. The first one, without a doubt, is that communities have got to be willing to stop thinking only about collaboration in the collective and start thinking about the individual partner's role in change. The problem with collective impact maybe is that everybody has the collaboration frame where they assume they can show up to a meeting once a month or once every other month, and all of a sudden everything's going to change. The truth of the matter is that for systems change to happen, each individual in this room, each individual in a partnership has to behave differently every single day. That means everybody has to look in the mirror and say, what am I doing right now that's contributing to the fact that too many kids are not successful in preschool, or that too many kids are not ready to graduate from college? What am I doing every single day? That was number 1. Number 2 was that we have to focus on the most vulnerable students, that we have got to focus on equity issues, that if we cannot move the dial for the most vulnerable, that we will not get people to believe that we can change the system. It gets to a little bit of what Jason was saying about getting wins, getting that flywheel turning, as Jim Collins would say. But if we don't address the needs of those who are struggling the most and be honest about the equity issues therein, we won't get people to believe that we can change systems. And the last piece, which is the lever for the first 2, is that we have to use data as often as possible, hopefully every day, to actually identify the bright spots so that people are forced to question what they're doing right now, not just looking at it to admire the problem, to say, oh, that's terrible, oh, we're just doing terrible, but to identify those bright spots, lift up what works, and ask people, can you change what you're doing every day, right? Can you change what you're doing right now to make sure that we're scaling what works for kids, right? Can you do that each and every day? And then secondly, can we do that for the most vulnerable children? And if we are able to use data in that way and have concrete examples of where we found out, for example, that in Milwaukee, we know that a certain type of attendance team, a certain type of team working together to focus on getting kids into schools, working with families once a week. That gets kids into school. If we know that works, let's as a community focus on doing what we do differently every day, focus on the most vulnerable children so that we can take what the data is telling us and spread those practices to get better results. So if you focus on those three things, changing your behavior every day, making sure that without a doubt, people are focused on the most vulnerable, and using data to do both of those things consistently over time, our sense is that you can get to systems change.
Thank you. Thanks. I'm really excited to be here today. And just to take a half step back, this work is so central to where the president thinks our country needs to go. And he said that if his first term was about the need to end 2 wars overseas and to deal with the worst economic crisis since the Great Depression, in his second term, it's really important to him to focus on another problem which is equally large, and that's the stagnation of middle-class living standards over the last couple of decades. And it's obviously a complicated problem. There's a lot of solutions to it, but it's hard to imagine any meaningful effort to make progress on that problem without increasing educational attainment, without helping more people get college degrees. And that means, by the way, meaningful 2-year degrees, meaningful occupational certificates, as well as college degrees. So that's the thinking behind the 2020 goal that he set. And we know how important this is. A generation ago, we led the world in educational attainment. If you look at our older workers today, they are still more likely to have a college degree than their peers in any other country. But if you look at younger workers, we're now 11th. And that's because over the past generation, we've essentially stood still while these other countries have passed us by. Now, I think the conversation that we started to have today is very interesting to me, because when we started working on the higher education policy speech that the president gave at SUNY about a year ago, we were asking many of these same questions. What is it that people are doing well that we can replicate, and how do we build on what we know, and what can we learn from healthcare? And it really is true that if you look across the country, there are examples of people doing all of this phenomenally well. And you can find isolated programs where people are helping students from the most disadvantaged backgrounds succeed, helping students learn much more faster, finding newer and less expensive ways to teach. And I think what we as a community are not doing as well is identifying where that is working, especially if it is someplace else, and figuring out how to replicate that, or better yet, how to top that. So if you look at some of the things that are working in the healthcare space, we actually are trying to pursue some similar strategies in higher education. And so that means some honesty about how we're doing, with some transparency. And we've put up a college scorecard to help students and parents get basic access to the most important indicators about how colleges and universities are doing. We're working now to try and improve that data, to try and have better measures of graduation rates than are currently available, for example, to try and have some standard, high-quality measurement of employment outcomes. Not that those are the only things that matter, but as a way of building toward what's important and how do we measure results. A second thing that is very important is building evidence of what works and how do we know what works better. The Department of Education has a program called Investing in Innovation that's been very influential in our thinking, at least in our own hallways. And the thesis there is, we want to do more we want to let the money follow the evidence, and we want to build the evidence. And so the way I3 is structured is there's 3 evidence tiers. And if you have an idea that's promising but doesn't have a lot of evidence behind it, you're given money to try it out and test it. If you have an idea that seems to work but with only moderate evidence behind it, you're given funding to replicate that and evaluate and demonstrate that it works. And if you have something with really strong evidence behind it, then you're given an even larger grant to expand that or to replicate that. And I think the emphasis on evidence that a program like I3 has is really important, one, because it allows us to demonstrate that funding is following results and we're really making hard-headed, pragmatic decisions with the use of federal dollars. But two, it also changes the incentive structure for the entire field. And when people are writing grant applications for the first time, in developing those plans, they are looking at the research evidence. They're going to the Department of Education's What Works Clearinghouse, and they're trying to figure out how can we build on this evidence to make sure that we are doing something that is evidence-based, and what can we learn as a result of this project to give back and pay it forward to make sure that we're continuing to build the pool. So that's honesty. It is evidence-based. And then the third thing is, one thing that we haven't mentioned yet today is resources. And the work of IHI has been incredibly influential. Another important factor in the impact that we've had in keeping healthcare costs to historically low levels over the last couple of years has been the reforms in the Affordable Care Act and the incentives that gives our healthcare system to integrate care, to focus not on the number of treatments someone gets, but how healthy they are, to tackle some of the low-hanging fruit. Infections ought to be a no-brainer. A lot of this stuff is really easy. And so, we should be thinking, too, in higher education, where the vast majority of funding goes to institutions on the basis of initial enrollment. What kind of impact does that have at a campus level? If an administrator has a good idea that costs a little more but helps increase completion rates, that funding has to come out of other funding streams. There's no dedicated funding stream to reward higher completion rates or more learning. And so, I'm over time here, but I hope we can talk a little bit more about that as well.
We started today's convening talking about big, hairy, audacious goals, and Lumina certainly has one of those, which is 60% by 2025. Now, the good news is college attainment is increasing. So if you look at our baseline from when we started measuring in 2009, there's certainly been an uptick, but it's not increasing fast enough. And so we are still about 34 million degrees short than where we need to be to meet that 2025 goal. And if we continue to increase graduates at the current pace, we'll still be about 19 million short in 2025. So certainly, in order to meet that goal, system change has to happen. Now, we talked about a new word, systemness, and I don't know if scalability is a word, but that's one I'd like to introduce, because we're really focused on which approaches, strategies, and interventions were designed for scale. Not all strategies are actually scalable. At Lumina, we've made some investments that have produced excellent results, but they've cost millions of dollars and have impacted very few students. And so now we're much more focused on those interventions that are going to reach the millions of students that we really need to be serving. So our practices and our investments are based on those interventions that we know will work, that are data-based, that can be supported by evidence. Some of those we already talked about this morning, including transforming developmental and remedial education. I personally don't think that a student should sit in a remedial course for 3 or 4 semesters. And when I was in Maryland, the data were very clear that too many of our students began and end their college careers in developmental and remedial education. So we are certainly focused on scaling changes in that area. We're looking at better pathways that will get students through more quickly to a degree, and mining your own data is a big part of that. One of the best but also most sobering experiences I had is when we looked in my state at all of our community colleges across the continuum, and we looked at how many credits students had when they finally got their associate's degree. And that ranged from 67 credits at one college to 116 at another community college. And so no one can tell me that there's not a problem there, right? And so scaling also has to do with policy, because we were able to go in using those data as a baseline and say, we need a policy that's going to make sure that this doesn't happen, that there's not a student who's actually only 4 credits shy of a bachelor's degree when they get their associate's degree. So I think we need to also consider institutional policy, certainly system-wide policies, and even state policies and the role that they can play in scale. And finally, at Lumina, we think that we're in a really unique position to give institutions some room to take risks that they otherwise wouldn't be able to take. When I was at an institution and also at a state, I was very grateful for the support of external foundations, because without those initial funding sources, we wouldn't have been able to try new and innovative things and to take risks. And so we really hope that we can be a partner with all of you as you are thinking about how to bring some of these approaches and strategies that we know work to scale. But we also hope that it won't stop there, that you can use some of the funding that we might provide to leverage additional funding. And so those are the best stories that I hear when I go in and hear from an institution or a system that said, you gave us $1 million, but then the state saw the great work that we were doing, and they've supported us to the tune of $50 million. That's how scale at the system level is achieved. And finally, we have to talk about sustainability. So if an organization like Lumina comes in and gives you $2 million, but then after the funding is gone, the work ends, that's not long-term change. That's not sustainable change, and that's not scale. But there's enough that's been done over the last several years so that we know what works, we know what can be scaled, and we know what leads to sustainable change. And I look forward to the rest of the conversation about that.
All right. So I would like to share with you a story about chronic street homelessness and how that, I think it really relates to what you want to do here in education. Back in 2003, I was hired to reduce street homelessness by 2/3 in 3 years right here in Times Square. In fact, my office was on 43rd and 8th in the Times Square Hotel. And at the time, there were 55 people sleeping outside on a night when it'd be about 18 degrees out in the middle of winter. And it was the highest density of street homelessness in New York City. I had just come out of the military and I knew absolutely nothing about homelessness whatsoever. The most frequent question that I got asked was, who put you in charge? And I was like, I did. Which is a key distinction between working within a small scale change and then large scale change. My team turned the way that street outreach was done on its head, and we did it by focusing on the very most vulnerable people who had been out there on the streets for decades in many cases, people who other outreach teams walked past and assumed they were service resistant and didn't want it, and it's this common theme here. We worked on helping those people get directly into housing. So it was a very disruptive innovation. Let me tell you kind of what I'm talking about is someone with severe mental illness who also currently has a substance abuse issue of one substance or another, whose foot is falling off because they have diabetes, who's living in their own feces and talking to themselves, and everybody, if you walk past them, just kind of looks the other way and hopes that, that's who I'm talking about housing. We reduced street homelessness by 87% in 4 years. It got it down to where it was just one person. In fact, that one person in the New York Times wrote up a story about, oh my God, who is this guy? And he's in housing now too. And so we had a very successful pilot. I spent 2 years going from city to city, initially with the kind of the hubris of replication, and quickly learned that it was what are the adaptable ideas, what are the spreadable ideas within this street to home model. And it was 2 years of living on the road, helping communities adapt this model. And it was when I got a call from Louisville, Kentucky, asking me to come help them, find their most vulnerable people on the streets and get moving towards housing them, that was my Waterloo. I was like, I'm not going to a community that has like 29 homeless people. I was like, the money you'd pay me as a consultant, you could house everyone on your streets, right? And I don't know if that's actually true. Louisville actually turned out to be great. I was like, I don't want to go to Louisville. Mm-hmm. And I met Joe. And Joe had done the 100,000 Lives campaign, who you'll hear more about. And I thought, instead of me just responding to whoever calls to help them with this one model that had been very successful, what I'd really like to do is house 100,000 people straight off the streets, those people exactly like I just described. So in 2010, we launched the 100,000 Homes campaign. And it was a national movement to find and house 100,000 of the most long-term and vulnerable people straight off the streets of America. Long story short, we used Dan Heath on speed dial and Joe on speed dial and did large-scale change development. We enrolled 186 cities. We did that by motivating the elephant, both in terms of very stark pictures of before and after pictures of people housed. It's stunning, the difference. I wish I could show you. I have it in my phone, just kidding. And we directed the rider. We made it a thing to support community performance level, getting to where they were housing at a rate where they'd end homelessness. We called it the 2.5% club. If you're housing 2.5% per month, it was an identity shift. You're one of us now. And when we started this, there were no communities housing at 2.5% per month. When we finished the campaign, there were 60 communities in America housing at that rate. And it was because we were constantly spreading the interventions that work. The sad news about ending homelessness is no one agency can do this on itself. It requires everyone working together. And that's the last part, was clearing the path. Over the course of the campaign, we helped dozens of communities quadruple the rate at which they're housing their most vulnerable people. So lots of lessons on large-scale change that Joe and I are now channeling into the Billions Institute. And it's a pleasure to get to share some of those ideas with you today.
Yeah, I would echo that. I'm really glad to be here and really enjoying being a part of the conversation. So, when I think of the core challenge in expansion or scaling, going from something that happens within an organization to something that's going to impact many organizations and many groups, I think it has to do with, just to be very simple about it, has to do with control. You have less control. You don't have executive authority to say you must do the following things. So persuasion and influence become much more important. And that was certainly true in the 100,000 Lives campaign, the initiative to reduce harm in hospitals that you heard Dan mention and Becky too. And I think to sort of address that problem of control, we came up with 3 ideas or 3 principles that were very important to us, ways to engage people without having that executive authority. The first way was to apply many stimulants. And what I mean by that is find a way to use every single method, every single tool at your disposal to engage people. So that can mean regulation, it can mean policy, it can mean recognition, it can mean celebration, it can mean collaboration. There are all kinds of reasons why people would be drawn to do work. There are positive levers and there are negative levers. But the work, I think, of someone who's orchestrating large-scale change is to sort of become a master at applying all of these different levers very opportunistically. Whenever the opportunity arises, you have to be fast enough to seize the opportunity and take advantage of it. So that was kind of the first idea, or the first principle. The second idea has to do with what we call wasting no will. People come to the work that they do on a daily basis with their own strong beliefs and their own strong desires. And rather than saying, here's our thing, this is what we want you to do, we got good at saying, tell me what's important to you, or tell me about the bad experience you've had with medication error in your hospital, or tell me about the worst thing that you've ever observed, and tell me what you want to do. Tell me what's really, really important to you. And our answer to whatever people wanted to do was always yes. So if a parent of a child who had been harmed in the course of their care came to us and said, we're really worried about medication error, we want to work on that, and we want to start to make art about that in the lobby of the hospital, we said yes, absolutely. If a doctor came to us and said, I want to work on central line infections, absolutely, there's a place for that. It came to a point where pharmaceutical companies were knocking on our door and they were saying, we want to be a part of your initiative. And I won't lie, it was a little bit of a, well, I don't know about this, yes, but we found a place for them. We had to find a place for everyone who wanted to contribute, because to do this work takes so much energy and so much effort that you can't waste any of that energy that people will bring to the table. And then kind of the third principle, or the third concept that we leaned on really heavily in the course of the work was the idea of getting to field. And getting to field means, let's not sit in our central office in Cambridge, where we were at the time. Let's not sit in our central office and pontificate and strategize and build the perfect plan. Let's get out to the field, and it's sort of what Jeff was saying. Let's do the work every single day. Let's collect data on the progress we're making, and let's try new things every single day. So things like rate of testing and rate of learning became much more important to us than coming up with the perfect strategy or the perfect plan. We stole a phrase from the US Army, which is amateurs discuss strategy, professionals discuss logistics. And that sort of sums up the heart of, I think, a large-scale initiative that works. We move from contemplation, which is actually kind of self-indulgent, to action, and we do our learning on the go.
Thank you all. So let's start here. Several of you, not starting with Jeff, but including Jeff and others, talked about the importance of data, right? And obviously, Lumina's goal is a data goal. Becky, you talked about it in a number of different ways. I mean, in some ways, there's nothing magical about data, right? It's just an accumulation of facts. But there is a fair amount of resistance in many places to using data too much, right? And you see this, if anyone here is a baseball fan, tonight's Game 7 of the World Series. If you see the general managers in baseball who've tried to push and to use more data, they always feel this need to say, well, of course, we don't just use data. Of course, we use intuition as well. I was once sitting in on a meeting with one of the top performing hospital chains in the country, Intermountain Healthcare in Utah. It was this great moment in which they were reviewing the case of a doctor who was inducing too many babies too early. And the doctor was not in the room, but they were talking about his case. And the person leading the discussion of these executives said, well, we all know what the first response is. And the whole room said, the data's wrong, right? And so I'd be interested in hearing all of you talk about how do you deal with the data's wrong? How do you bring along people, not treat data as always right, because sometimes it can be misleading, but let's focus on the idea, how do you bring people along to be willing to look at data, even when it isn't showing what they might believe about themselves?
So we had in Cincinnati a key moment, and the chancellor was the president of the University of Cincinnati at the time, and we were trying to figure out how could we get to this systems change, and we were trying to just put out a report card, a baseline report card, on where we stood right now on those 6 outcomes that I listed. And there were incredible fights among all the different stakeholders. It was akin to the fights that happen in the literacy world around phonics versus whatever the other side is, where it literally feels like there's a war going on. And it was actually the president of the other university in town, Northern Kentucky University, that Nancy worked very closely with, that stood up and said, folks, we cannot let perfect be the enemy of good. We cannot let perfect be the enemy of good. We have to put out the data we have and trust that over time, good data will drive out bad data. But not even in the private sector do you have perfect data to make incredibly important decisions. You have the data you have, and you need to work with that data right now and make the best use of it that you possibly can. And I honestly think that higher ed has a huge role to play here. Because I'll be honest, to have the president say that and to have some deans of the College of Education say we can't let perfect be the enemy of good was a big deal. Because it was a lot of the university counterparts that were saying we needed perfect data. We needed to have data at the level of a double-blind, randomized controlled trial in order to do anything whatsoever. And I think what we have to be comfortable with is that, yes, there is a role for research and evaluation as it's been defined, but there is just as important a role, maybe over time a more important role, for using data for continuous improvement each and every day. And so I have to just put knowing that there's a lot of higher ed leadership in the room, put it back. One of the things that I think you all could do every single day is ask, that's great that we need this high standard for using data to get to the evidence that's being really pushed by the administration that we think is great. And can we think about how using data every single day in order to make improvements?
And I guess I can talk just a little bit about the higher education context, because in my state, there was a real concern that people would interpret the data incorrectly or use the data out of context or see one data point and make an irrational decision that would have a negative impact on a campus. And a couple of things happened. We had leadership from the governor who said repeatedly, what gets measured gets done. And so there was an expectation that we were going to take a hard look at the data. It might reveal some things that we weren't pleased with, but at least we would know where to target our energy and resources. But we also try to present a picture of how the data could be used to the advantage of the institutions. So even if you were an institution where the students were graduating with 116 credits when they could have been graduating and should have been graduating with 60 or 62 credits, once you know that, what then do you do? And that particular campus president immediately went back, conducted degree audits, saw that there were hundreds of students that could graduate right then and there. So not only did she graduate those students, but she put the policy in place such that that would never happen again. And so letting folks know that while data can be used for evil, it really should be used for good, and giving them clear examples of how it can be used for good, not only to the benefit of the institutions, but ultimately to the students that we all serve.
Joe or Jason? Sorry, Becky, go ahead.
Oh yeah, I'd love to add. We were in a similar situation to where you are with your 2020 goal that you're going to be a couple million short. A year and a half left with the campaign. Our projections were that we were going to be the 30,000 homes campaign. Now, I had already gotten a tattoo of 10,000 with the comma in the wrong place, with the holding place for where that last zero would be when the 100,000th person got housed. So I did that when we hit 10,000, perhaps a moment of excessive exuberance. and so when my data person was like, Becky, you're on track to be the 30,000 homes campaign, I was like, that is really bad. And so we had that moment, right? So we faced into the data, and my team from that point on, every single week, the first thing we did on our team meeting was we faced into the data of how many communities have we enrolled and what is their performance. And what we had to do was get hundreds of cities who all we had was good looks and personality to improve the rate at which they were housing the most dirty, stinky, vulnerable homeless people on the planet from 1.6% per month to an average of 5% per month. And the way we did that was we created, and this had never been done before, which is somewhat shocking, a report for them that had, here's the current rate at which you say you're housing these people. Here's all of the resources that people have squirreled away in a variety of different hiding places across multiple organizations. And this would be the rate at which you would need to be housing in order to actually be making any progress whatsoever in this, but also selfishly for us to hit the 100,000 shared goal. We presented people this data, what we had to help people do in order to overcome this was overcome their fear. And Joe and I talk a lot about creating a container that's free of fear, and that's an important role of leaders. So we started these sessions by me standing up and saying, these are the 4 ways you're going to get scared. You're going to fight me. You're going to run away, you're going to faint, and you're going to be like looking at your BlackBerry, not paying any attention, or you're going to freeze. And this is what this is going to look like, and that's okay. This is going to happen, but we're going to look at this together. And it was sort of like Dan called it, a stink bomb of love. Like this is the mirror, and this is what it looks like, and we're going to do this together. And yeah, if it's a little bit wrong, that's fine. Make some changes around this, but directionally, this is where we're going. And it was routine for communities to cry. We called them tears of change. We had Kleenex on the tables, and that's okay, right? So that's what leaders do, is they create a context within which you reduce the fear enough, but you have enough of data that you can support people making different decisions. And those communities that went through this process together quadrupled their housing placement rates in 100 days, by the way. I'm not talking years.
So I want to quote you real quick, Becky, and make sure I get this right. So we had a quick conversation on the phone once, and I asked, though, how did you get people to be willing to talk to each other about data? And your answer was, well, I hired people that the folks in the community actually liked.
Yeah.
And I thought that was really interesting, because we often think all technical and all this, and we want to get technical around data. But you need to have people that can break down the data so that people can actually hear it, right? And trust that it's not going to be used as a hammer, but a flashlight to help them do what they're doing better. And I think there's something in that, because we think about data, we get this picture of a data geek, a wonk in our head. We actually just need people that folks like and trust with that data to present it to them. I don't know if that's accurate or not.
Totally. I think one of my greatest assets as a leader of this movement was that I was likable. And then my friend said, did you say like a bull? Like a B-U-L, like a, I was like, no, it's likable. Yeah, I think, and data is used so often as punishment, and you have to create a shame-free environment, I think, in order for to pull this stuff off.
If I could just put a somewhat different spin on it, in the sense that I think that at least in healthcare and what we attempted to do to sort of convince, I'm a big believer you need data to convince people that the status quo is not sustainable. That the path you are on, because people by their nature, if they believe that the status quo that they're comfortable with, even if they acknowledge that there are problems with it, that they will want to defend it. It's like a natural human reaction to try to keep things where they are, because always that fear of the unknown. But if you want to convince people that change must occur, you must use data to show that. And I think it's not only that you show the problem, but I think if you can show that the status quo is not only unsustainable, but immoral, you potentially create a very powerful incentive for change that I think is underappreciated. Sometimes we put these statistics out there, and we don't talk about the fact that, these statistics are real human beings. And I think in healthcare, it's a perfect example. We have a healthcare safety net in the United States that, particularly here in New York, and particularly in this city, especially if you go across the river to Brooklyn, you will find a healthcare delivery system that relies on the fact that people are getting sicker than they should, are going into hospitals when they shouldn't be there, and therefore that's what generates enough revenue to keep these institutions alive and functioning and people employed. And that, in my view, is immoral. And we as a nation need to change that fundamental structure so that the providers survive when they're successful, not when people get sick, but when they get healthy. And that's been part of what, in terms of our initial efforts about trying to make the program more sustainable. Now what we're doing in Medicaid is trying to make the delivery system more cost effective and refocusing the delivery system on terms of trying to keep people well, as opposed to trying to maintain a system all about people getting sick, and that generates revenue and that generates sustainability. This next step that we're on is really, really hard. It's hard to get people who run these large institutions to understand that the system that empowers them, employs them, is in essence, in my view, morally bankrupt. And that's a challenge because that's very scary, because they've been so used to a philosophy of filling beds. It's heads in beds is literally the phrase that's used across the industry. And that's got to change, folks, because if we are going to get healthcare out of being, a sixth of our economy, twice almost any other nation in the world in terms of percent of GDP, we have to break away from that philosophy. And that's not easy, but I do think using data to make a moral case, which I sometimes think in the case of Obamacare, I don't think the president made as much of a moral case about the value of health insurance and moving people from uninsured into insured as probably they should. Because I think at the end of the day, people are motivated by a moral mission. And I think that if you can implore upon people that, along with all your good statistics about why you need to improve and how you can improve, I think you'll be more successful at major system change.
And there clearly is a version of that in education, right? In education, sometimes it's filling seats, right? And that is the way the government funds a lot of stuff. And yet we have a situation in which there are institutions and aspects of institutions that are receiving taxpayer money and are not serving their students particularly well. And yes, some of them are for-profits, but they're not all for-profits. James, you made a little bit of a data apology yourself when you were talking. You said you understand the metrics that you're putting out aren't the only things we care about, right? That's, I assume, because you're going to be, the administration is going to be harshly criticized when it puts out some of these ratings and some of these frameworks. How are you going to try to get people to say, look, this data may not be perfect, but it's pointing to some real opportunities where we can do better?
Well, in some places, the data that we have is really important. So, for example, we have some ongoing work with the for-profit colleges that you just mentioned. And many of those do a great job that we could all learn from. But there are some that leave students with very high debts and very poor employment prospects. In that case, you have programs where their mission is to get people jobs. And so it is much more straightforward. You can measure, are they getting people's jobs? And the question of broader higher education is more difficult because there are a lot of missions to higher education. And when someone has a bachelor's degree in philosophy, the question of whether or not that person is earning a certain amount of money is not considered the only outcome of that degree. So I think it is tricky. Now, I think one thing that we know is that we want institutions to be graduating students. And it is possible to do a much better job of asking that question than we do now. And I think everyone knows the problems with the definition that the Department of Education uses, which ignores part-time students, ignores transfer students. That's the vast majority of students at some types of institutions. So, I think we can do a better job of measuring that. And then I also think it is possible to provide some information about employment outcomes that's useful to students, to parents, to institutional leaders. And it doesn't have to be done. I think people have the intuitive response. What about teachers? What about people being prepared to go into public service? What about What about students who are going on to graduate school and so they're not learning anything? You know, we can take a look at all of that stuff. There's a lot of different ways to do this statistically. We can look at, you know, how many students are earning above a poverty line wage and measure that as a potential outcome. So anyway, there's a lot to do there that I think is, without question, one useful piece of information for campus leaders to have, as well as parents and students. You know, some other parts of it are much harder. I think Dan is absolutely right when he said that we're not totally clear on what the mission of higher education is in all cases. And there, you know, I think we're looking for ideas for the community about what ways they would like to make the case that their institutions are delivering value in ways that are not easily quantified.
Becky, your example earlier of the photos, the before and after photos, were those things you were showing to the people on the street?
No, so we took pictures of people on the streets. Like.
Who were you when
yeah.
you were showing the kind of how life can change? Were those photos you were showing to the people you were trying to move into homes?
No, the audience for that was people who had resources that could result in those people getting housed.
Okay.
Yeah, it was more that.
Okay, so my question, you're saying that made me think of it, even if I misunderstood. So my question is, what role should students have in all this, in this large-scale change? And to sort of put it bluntly, are our expectations for students too low in higher education? Should we increase the incentives, both carrots and sticks, for things like remaining on pace to graduate in whether it's 4 or 5 years? Should we, West Virginia has done this interesting thing where West Virginia is one of those states that has this scholarship, that widespread scholarship you can qualify for. In a lot of southern states, they're tied to lottery money. In West Virginia, they changed the rules to say to get it, you must remain on path to graduate in 4 years. Shockingly, they saw a change in the number of kids who graduated in 4 years. Should we be doing more things like that?
Yes.
One word answer.
If it works.
And so what are some of the kinds of things, either from the lessons you all have seen in your own fields, or specifically from higher education, what are some of the things we should think about to put some of the onus on students without obviously ignoring the fact that many of these students may have to work, may have kids to care for, may have parents to care for?
Well, I could talk about a couple of the ideas that we've talked about in the past, you know. And the thing that makes this very difficult is you need to be extremely sensitive to the needs of disadvantaged students. And for some students, it's not realistic to take a full-time course load. Some students do struggle. And, you know, I think our system of higher education is very American in the sense that we believe in second chances or even third chances, and we want to let people to get back on track. But there are things that we can do. So, for example, we've proposed changing the Pell Grant program to give institutions a bonus if they are graduating both a large share of their Pell students and a large number of Pell students, try and help institutions focus on getting Pell students not just in the door, but also through the door. You know, I also think it's worth looking at the academic requirements in Pell. In New York State, they have a concept called failure to pursue for the state scholarship grants, which expects students to at least complete their classes, even if they don't pass them. They're expected to at least finish the term and earn a failing grade. There's nothing like that in federal education law. In fact, the academic requirement. The academic progress requirements are very weak. So I think that would be a place to look as well.
I mean, if it depends on if we're thinking about the institution as it operates now, or where we think the institution may need to operate in the future. And I think what we're seeing a trend towards is completely individualized education, right? So it's not about the institution's statistics, it's about the student's success. Right? So what if you actually said that rather than the advising system for a student being that they get 15 minutes with some sort of somebody in the institution at the beginning of the semester, what if, like at the College of New Mexico, you change advising completely to be a deep one-on-one relationship with somebody who asks the student, what are your goals for success, and discusses with them what they may need to be in order to thrive, and then they build the higher ed experience around the student rather than assuming that a one-size-fits-all model is going to be good for everybody else. I think if we can imagine that that's where we need to go, that changes just about everything, because it's focused on the student as a customer, as opposed to just a number that has to figure out how to be slotted into a specific paradigm that exists right now, right? And I think that's the kind of thinking that we're going to need, because quite frankly, we're going to have data available at the student level in order to organize systems in that way. And that's the reality that we need to lead to. And the student should drive that, right? The needs of the student should drive how we organize their educational journey to make sure they get to what they define and what we know is needed for success.
And I could add to that. I think if you look at healthcare, one of the buzzwords is patient-centered. Everyone's talking about how we can design healthcare systems to be patient-centered, putting the patient at the center, which has historically been a provider-centered, provider-centric system.
Which is remarkable.
Right? And so, yeah, crazy sounds, but it's true.
It's
so
the same
now
in
it's all
education.
about, and I think it's the same with the education. I mean, I am not a higher education expert, but I have gone through higher education myself, and having sat in large rooms and had been lectured to, it can be a dehumanizing experience. It makes it not very student-centered. It can be actually very sort of, the faculty centered, the faculty at the center of the universe. And I'm not saying that you can change that model overnight, but if the thought could be more about how the student's at the center, and I think, it was mentioned earlier during the keynote address about the need for more student feedback. I mean, I think, and I think the private sector, government, we're all victims of this, where we don't actually attempt to get feedback from our stakeholders, our customers, our employees as effectively as possible. But I just think starting to think about education more student-centric as opposed to institution-centric or faculty-centric might be a way to start.
I mean, and to pick up on that, if you really want to know about chronic disease in healthcare, don't ask a primary care physician. Ask someone who has diabetes. Ask someone who has chronic heart disease. I mean, these are the people who really, really understand what it's like to navigate the system in all of its complexity and all of its intricacy. That's the same discipline that I think any industry that's interested in changing itself needs to bring. What does the customer need and require? And let's get really serious about knowing and understanding that and getting to the field. To this issue about sort of setting higher standards, just a little nuance, and I don't want to make too fine a point, but there are more and less sophisticated ways to measure progress. So you can say to a student, you need to get an 80 or you fail out. Or you can say, I'm interested in your rate of progress over time against yourself. So if improvement is really the goal, if what we're really interested in is how a student is actually progressing, certainly in healthcare, when we assess healthcare facilities, it's not just a single point in time measure. We're interested in improvement over time. And that is viewed as a much more just way of doing assessment, because at least people can point to the fact that, well, they may not be at the level of some world-class teaching hospital, but they're making a lot of progress against themselves over time. So I think we can design measurement in more sophisticated ways to actually have more impact.
Higher education strikes me as arguably the most stable, large important segment of our economy, right? The list of important universities in a state in the country has changed remarkably little over a very long period of time, right? Mm-hmm. That seems to have both advantages and disadvantages. I'd be interested in your thoughts about how higher education can try to have more turnover, assuming that would have some benefits. I mean, Jeff, I think, used the phrase fail forward, right? Where maybe you start something, it doesn't work, and so you get rid of it, right? Mm-hmm. What is it that higher education can do to make sure that it is willing to take risks and be okay with the fact that some of those risks aren't going to work out, and maybe other of those risks are going to grow into something that maybe even displaces things that exist now because they're so successful?
I think that higher education is going to have to change because the market is demanding that happens. So our goal is 60%, but it's not just 60% four-year degrees or 60% associate degrees. It's 60% of credentials that will allow people to be successful in the workforce. And what we know is that some people are getting the training and education they need, not from our higher education institutions, but from their employers, from other entities in the community that are able to award credit, and then they translate that learning into a job. And so I'm hopeful that higher education understands this. Students certainly understand it. They're going to where they can get the learning and the training. And in order to remain competitive and to meet the needs of today's consumers, today's students, who are very diverse and very varied in their needs and the way that they want to pursue their education, I think that higher education is going to adjust because there are other providers who are serving the needs of today's students.
I think, sorry, go ahead, Beck.
I have a real concrete answer to that, and Clayton Christensen writes a lot about this in The Innovator's Dilemma and Disruptive Innovations, is as a commitment as a part of the institution that X% of your budget goes towards innovation and discovery and trying new things. And so he recommends, I think, 4% of your budget goes towards trying new things. And I think that the key to that is that you do it in a disciplined way, that it's not just winging it and seeing what happens and like mad scientist type of stuff, but that you have a disciplined way of trying new ideas and spreading new ideas throughout the campus, but putting your money where your mouth is. And that 4%, the other really critical part of that is isolating that 4% from the rest of the culture, and Dan talks about this in some of his trainings with Switch. You have to isolate the innovators from business as usual and protect them so that they can truly be innovative and create new things.
I was going to say, when I look at healthcare and the change in quality in hospitals in particular, the major driver has been boards and C-suites. And I think when the board decides that the way that we're going to assess ourselves is not with an annual report that looks at sort of metrics from the past, but we're actually going to sit down every quarter, or even better, every month, and say, how many people have we harmed as a result of medications? How many people have we harmed as a result of infections? How many people have we harmed as a result of surgical complication? That habit, it's really, for me, it's a set of leadership habits. It's like, I can look at the calendar and tell you whether this organization is in the rhythm, it has the tempo to actually kind of learn and improve. So for me, it's kind of re-engineering almost the day-to-day work of the institution to drive that behavior. That signal from boards and from the executive will be very powerful.
And maybe one of the most powerful incentives or one of the most powerful levers from those boards could be to add incentives. So that if the primary incentives now in higher ed are publishing and bringing in resources for projects, what if another incentive was moving a dial in your community? Right? What if you were able to get tenure because you contributed to improving early grade reading rates or college readiness rates or college completion rates? And we're seeing one community very practically where they've started to pull together the K-12 superintendents and the presidents of the universities. And they've asked, could the universities, the colleges of education specifically, give data back to the K-12 districts on how the teachers that they have prepared are performing in the classroom? Like, how could we just give that data back? And what if we uncovered that some of the colleges of education were doing a phenomenal job preparing math teachers? Like, maybe there was one, and maybe we just have to ask them to be that segment of our work, right? Maybe they just drill down on only preparing math teachers. And another institution zeroes in on preparing teachers to train kids how to read, right? And we begin to see that there's some segmentation in higher ed institutions because they're really good at things. They're doing things that are great rather than assuming that every institution has to do every single thing. And they may do that segmentation based on moving local dials, an incentive that celebrates improving local lives as opposed to just doing things like publishing resources and research and bringing in grants.
Can I just make one more point, which is I would quibble with the premise a little bit. I think if you look at the U.S. News rankings, it certainly is striking that those institutions were all founded in the 1600s or whatever. Those institutions, that ranking system judges institutions in part by how many students they turn away. It measures instructional quality by the amount institutions spend. That is like the exact wrong type of thing that we should be asking when we're trying to build a higher education system that takes all types of students, that's affordable, and that gets good results for them. So, I think if you looked at the higher education system with a different lens and you asked, where are the students going, you would see community college system now enrolls half of students, essentially built over the last 2 generations. Even over the last decade or 2, you have the rise of for-profit universities. Now their enrollment is shrinking. You have Cal State building whole new campuses. So, I think the challenge is how do we get a focus on institutions, and SUNY is one, that are doing a great job enrolling all types of students, being affordable and getting results, so that our conversation around higher education is centered around the institutions that are going to be producing millions more graduates, and we're talking about the central role that those institutions play in our future.
I mean, that's a fair point. I do think that almost no matter what lens you look at 4-year colleges, there's been a lot of stability, right? Even if it's not the U.S. News one. But that is a good point. Let me end with you, James. Obviously, there's so much interest in what the administration's doing here. We have just a couple minutes left. Can you just give us a preview of what you all are going to do and when you're going to do it?
That was on the card I just dropped.
I think we're out of time, actually. If you look up at the clock, it's all over.
So, as I said, this is a very important area for the president. He's invested quite a bit in higher education. We're actually spending, we've doubled spending on Pell Grants since the time the president took office. The college tax credit is twice the size that it was when the president took office. Between the two, you're talking about an additional $20 to $30 billion a year in federal scholarship spending, which is quite significant in the context of a sector that's $400 billion in total. We are working now on a concept that I think is very important, if not revolutionary, which is letting all students cap their student loan payments at 10% of their incomes. That's going to let us say to students, no matter what, we can guarantee this student loan is a good investment. This student loan is a good investment for you. And if you're unlucky in the job market, you have some kind of illness or disability, we will co-invest with you because we believe that college is such a great investment for you personally and for us as a society. So there's a lot of investment going on. At the same time, the president has said that he feels that colleges need to focus on the responsibility of providing a quality education at an affordable price. And part of that is talking about the types of institutions that are succeeding at doing that, which are not all getting the types of national attention that I think they deserve today. The president has said he wants to put more information out there on the types of institutions that are doing that. He's asked us to look at measures of which institutions are affordable, which institutions are enrolling students from all types of backgrounds, and which institutions are getting good results, who's graduating students, who's going on to get jobs. So we are working very hard on those types of questions. We've done public hearings around the country. We've published public notices inviting comments. We've had technical experts over at the Department of Education to share their views. We want to make sure that we're doing this smart. It's particularly important to us to make sure that we are rewarding institutions who are serving the hardest to serve students and recognizing that that job is sometimes more difficult. We will be publishing in the coming weeks some additional, more specific questions that we'd like input on. Some of them I think were surfaced today. I think the challenge of figuring out what questions we want to be asking about the missions and how do we measure that, I think is a goal that's is a difficult question. It's one we could use a lot of help on. And then, the president has directed us to have this new information available to parents and students before the beginning of next academic year.
Thank you. Please join me in thanking this great panel.
I think I'm talking after you. Three times my energy level.